Okay, all good. This meeting of the Dundee Township Mental Health Board is called to order. President of the board presiding. It is 7:01 p.m. Secretary Corns, please call the roll.
Adame. Present. Auger.
Present.
Connell.
Here.
Corns here. Harney.
Present.
Kemp. And Avalar.
Present. We have no remote attendance requests, so I will ask all rise. Please remove covers, and Ms. Katie Began, please lead us in the Pledge of Allegiance.
I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Amen. Chair will entertain a motion to adopt the agenda as presented.
I'll
Moved by Adame, seconded by Auger. Discussion? All in favor, please signify by saying aye. Aye. All opposed, same sign. The agenda is adopted. Chair will entertain a motion to approve the meeting minutes of the regular meeting of September the 11th, 2025.
I'll move.
Moved by Auger. Second by Connell. Discussion? Hearing none. Secretary, please call the roll.
Adame.
Yes.
Auger.
I'll pass since I was not here.
Connell.
Yes.
Corns, yes. Harney.
Yes.
Avalar.
Yes. Minutes are approved. Chair will open up the meeting now for public comment. We have one person signed up thus far. I'm going to ask our former administrative coordinator, Jared Sanchez, please take the microphone. You have up to 3 minutes.
Thank you. Hello, board. Different seeing you on this side of the table, but no lack of encouragement nonetheless for the work that you're doing, and that's really what I'm here to talk about tonight regarding the police social worker program. I know you know the value of the program, and it is on the agenda tonight for the potential vote on the allocation. I know there has been some hesitation, but hopefully the answers to your questions that you received are sufficient to at least allow you to feel comfortable moving forward. I know, sometimes we want to get everything right out of the bat, but this whole process really comes from my experience on the county board, where we have department heads and elected officials that will come to the board with ideas for program expansion and things like that. And we give an initial allocation, which isn't a guarantee of anything. It's just saying we allow you to use your staff time to go forward with this, flesh out the plan, and then bring it back to us for the actual funding. So that's really all that is contemplated tonight, is allow that initial allocation so that we can, or you can inform legal to begin working with Carpentersville's team on the IGA. And that's where any loose ends, any unanswered questions, any specific details and requirements can then be inserted into the contractual process going forward. I know there's been some question about the ongoing funding. We're contemplating an initial 1-year IGA with the option for a 2-year renewal. That gives 1 year to show proof of concept, and then 2 years for all of the related partners to build it into their budgets. It's whether or not they might have a few extra dollars here and there this year. I know government budgeting pretty well so far. It takes time to add something like this into their budgets going forward. This will see a 37% increase in services to the township residents. So that's a big increase. And then, obviously, if this goes well, you can really go after expanding to 100% coverage for the township. So, with that, I just, again, want to encourage you, and you guys have been doing really good work so far, and just happy to see you continuing to do that. So, thank you.
Thank you. Is there any other member of the audience that wishes to address the board during public comment? Seeing none, we will move on, and I will move to the coordinator's report. Ms. Began.
Hi, everybody. Thanks for coming. We'll keep it real short. The primary activity over the last almost 30 days has been transitioning from Jared Sanchez to myself. So lots of just onboarding, how-to process, procedure, lots of explanation, a lot of discussion about the program applicants, and still in the process of conducting one-on-ones with the board members. So hope to finish that up this week. And we can move on to the finance report questions, and I'd like questions for this section to be directed to Jarrett, since he has the
Okay,
knowledge.
we will cover that when we get to the approval of the financial and the
Okay.
agenda, so go ahead and continue your report.
That's the next part of the report.
Okay, so basically your report's
Yeah.
concluded. Okay.
Yeah.
Very good. Any questions for the interim coordinator at this time? Seeing none, we will now move to the ad hoc search committee report. Chairperson Auger.
All righty, thank you very much, President Avalar. So we are, at last month's meeting, the board approved an extension of the RFP for 1 month. So we have the window open for some additional candidates. So far we have 3 applicants, Mannix, Region 1, and an individual by the name of Dr. Troiani. All 3 seem very qualified. They bring different skills. We have a deadline for the RFPs of October 17th, and what we will then proceed to do on October 21st is have a interview process for the 3 candidates or any others that have come in. President Avalar, you sent me something that I have not yet looked at, but we'll process that beforehand. The ad hoc committee will meet on October 21st at 6 p.m. We will interview the candidates at that time and make a recommendation to the board. We did use a number of job sites, which was different than what we did the first time we did a coordinator RFP. We did have a lot of applicants. However, what I've learned is we need to be more precise in the application because anybody can apply. And we had a large number of applicants, but unfortunately, none appeared as qualified as the 3 that we received RFPs from. Let's see. Next page. This is just the overall schedule that we've been following. So we will go ahead and continue on that. Like I said, October 21st is our next ad hoc search committee meeting. We hope to have a recommendation at that point, and then it will be available for full board consideration on November 6th at that meeting. The next page is just some more of the scheduling, long-term, that needs to be revised based upon the extension, so that has not been touched yet. And that should be the report there.
Okay, any questions for Chairperson Auger? All right, for the benefit of the audience, this is for our filling of for the permanent administrative coordinator for the Dundee Township Mental Health Board. So the process is very meticulous, drawn out to ensure we do a wide search and ensure that everybody who's qualified and who wants to apply applies. It's going to be a very fair process. The members of the ad hoc search committee is led by Chairperson Auger, and members Connell and Adame are the other 2 members. So, and I am an ex officio member as the president of the board. So the voting members will meet on the 21st, and that's when the interview process will be. So that's the 21st of October, and then the recommendation will be sent for the board for the November meeting. So that's just an explanation to the audience.
One more thing I'd like to add.
Yes.
For board members that would like to attend the ad hoc committee and perhaps may have some questions of their own, you're free to attend.
Thank you. That's a good call out there. Thank you. All right, so we're going to move on to the financial report. The chair will entertain a motion to approve the list of bills of the October financial report as presented.
A motion.
Motion by Connell.
Second.
Second by Harney. Discussion. Ms. Began.
Is it okay to turn this over to Jarrett?
Yes. Jared, she's requested, so if you can take the podium.
Oh, yeah, if you could.
Say again?
Look, if you could go to the PowerPoint, Katie.
To the PowerPoint.
I'll back
Yeah,
to
just
that.
because there were some questions that came up. With the FSA invoice, there was a Scrivener's error, so it is in fact the August invoice, not the July. The invoice itself states that. It's just the first page does not. And the current invoice will exceed the total allocation, so really it's up to the board to decide if they want to increase the allocation or to ask FSA to amend this current invoice and clip it at what would be the full allocation amount. Waitlisted clients, I was asked again, that has come up before, and really there's always a variety of reasons, no singular reasons, but it typically has to do with the constraints of the client themselves. You know, whether they need a counselor or therapist that's on a Tuesday night at 7 o'clock that's bilingual, or you know, whatever it is in their life situation that it makes it more difficult to place them with somebody. That's typically the reason clients are waitlisted. If you go to the next page. The Acre Center invoicing. So we do have two programs. One program is now going to be exceeding its allocation. The other program is well under its allocation. So then now it's really a board decision if you would like to allow ECHR to essentially pool those funds for both programs, not to exceed the total allocation, but you know, if the crisis services is coming in way under, and some of the or that money could be going to the outpatient services, you know, and they'll build more of those services then. That's really up to the board to decide. So whatever you guys would like to do going forward, then you can have Katie instruct ECHR, hey, you're over your limit on this one program, but you can use the funds from the other. You just can't go over the total allocation. So that's probably the simplest way to do it. But otherwise, you would have to just say, no, you're exceeded in outpatient services, and that's it. There is a printer purchase that is for the administrative coordinator's office for small print jobs, especially since we're not really able to utilize this office printer here from the township except for these meetings. And then round 2 invoices, we have started to see those come in, but they didn't come in time for this meeting, for this agenda. So you will see the first of those coming in next month. And that's it.
Okay, anything you want to add, Stephen? Jarrett or Katie, one of the two of you, y'all received the feedback from Member Auger. I know he'll follow up as well. I think you applied the suggested corrections onto the final report that we received. Is that correct? You're nodding your head. For instance, ECHR, we did not put the full amount that was originally requested. We put the amount that's left in the budget. At least on what I'm reading here.
No, it's still not completely
Not
broken
complete?
out in the final.
That's the original version, so that'll be updated for next month.
Okay, so what are we supposed to be approving tonight then?
Yes, we did.
Okay, actually, Member Auger, why don't you give us the explanation?
Well, I guess so our current financial tracking did not break out the programs, and some of our applicants have multiple programs. I think to be consistent, we need to make sure that we are tracking each program, not the total lump sum of money that goes to a provider.
Yeah.
So I subsequently provided Katie with a revised spreadsheet that will take that into consideration going forward.
Okay.
So that will appear.
That will appear in a subsequent.
Okay.
We don't have it now.
We don't have it now.
Okay, so for tonight's approval on the report as presented, is this the correct amount, or do we need to amend the motion to reflect the correct amount?
Yeah, so I mean, I would make a motion that we amend the FSA amount by, I believe it's $782.14. That would take them to their limit for the application.
And then what about ECHR?
The ECHR, give me a moment. I guess my recommendation there is we just caught this overrun issue. So I don't think we should penalize them for the money that they've already been charged, but the invoices that are come in now for the outpatient services, I think, should be held up. The crisis center we could pay for because that is under budget.
Okay, so let me make sure, let me replay this now. Now the motion to amend is to subtract $782.14 from Family Service Association.
From their invoice.
From
yes.
that invoice. And you're suggesting no action tonight on adjusting ECHR?
Yeah, I would request that we remove the ECHR outpatient invoice from the agenda for tonight.
So
or
is
from
that,
the
is
approval.
that the total 15,661, or what is, how's that broken out?
So, right now, if we look at the outpatient services, their invoice would exceed the allocated money by $13,828.75.
So for tonight,
So my recommendation would be to go ahead and table that or
okay, so basically...
defer that outpatient invoice, but only consider the crisis center one.
All right, so what is the amount? I'm trying to find it. Outpatient invoice.
There's like 3.
There it is. Okay, so the $5,048.75, that is what we're going to remove from tonight's approval. Is that correct?
That's what the amendment, that's what the motion, what is it?
Well, there's
a
August,
motion
September,
or
and there's July, August, and September.
I guess I was
July
starting out
is
by giving my
August.
opinion.
Oh, okay.
We can
Alright.
follow it up with a
So
motion.
they have an outreach.
Okay, so I'm
This is
seeing...
what I'm seeing here.
Yes.
So the amount remaining
So-
would match that.
The request would
For
be
this
to
first grant.
defer the $5,048.75 payment
For family services?
for Eckerd.
All right, hold on a minute. Member Corns, I think you found the different... Okay, are we
So
looking at
this is the first grant. It says there is $15,661.25 remaining. That matches this amount that we would be
Mhm.
paying out. But then this is their second for the outreach or crisis center.
No, that's for the teen
The teen,
counseling.
okay.
That's a different one.
So we didn't separate this one out.
Yes, that's the one that's not separated.
And do we know how much we allocated for the crisis?
The crisis center, they allocated $29,000,
Okay.
and the other one was $20,000.
And what,
Okay.
what is Ever, and is crisis center and Ever, are those the same?
Yeah, crisis.
Well, they have a crisis like outreach that we were
Okay,
funding, and then
crisis outreach,
outpatient,
crisis center.
and then the teen. So there's 3 different programs.
Okay.
Okay, so I'm looking at 2 different outpatient invoice amounts, $55.95 for August and $38.54.25 for September. Is it?
And then the July.
And then the July of $5,048. So which of those 3 are we subtracting out?
I would request that we remove the latest one. Well, I guess
That's $38.54. That's on the October 2nd invoice.
okay, but that is
That's for outpatient.
okay. So
We're talking about Ever.
So,
No.
yeah. So I guess I would say defer all outpatient invoices until we can straighten this out and approve the crisis center one.
All right, so then the motion to amend, removing FSA by the amount given of $782.14, and then removing the outpatient amounts, which adds up to,
8,800 and
no, I think that's an undercount. It's more than that. Bear with me. Okay, the total is $14,498.75. So from the Ecker total, remove $14,498.75.
President Adler, if I could
Yes.
add one thing. I'm just thinking procedurally, we're going to have to request new invoices be sent from both FSA and Eckerd, given what you guys are talking about. You may just want to postpone the vote on both total, so you don't have to worry about these, because they're going to have to send a new one anyway in order for the accounting to process it.
I
You can't
appreciate-
just scratch
I appreciate,
your-
well, that's what we're doing. We're amending the motion. Instead of as presented, we're removing the respective amounts that they need to send invoices, resend invoices for.
Okay.
So that's actually what we're doing.
Yeah, 'cause they will have to send new invoices.
So I just want to get the right dollar figures on here so we approve the correct amount to remove. So,
Okay.
thank you, though. All right, okay, so is your amended motion set to be 782.14 and 14,498.75? Mr. Auger?
if that's the amount that it totals up to, yes.
Okay, is there a second for the amendment?
I'll second.
Second by Corrins. Any more discussion?
Yes, I have some questions.
Say again?
the Family Services thing, do I understand correctly that they've reached the end of their allocation for the grant that they have? Is that correct? And do I also understand that we could choose as a board to expand it slightly? Like, we're talking $700 or something like that?
We could, but I don't think it'd be at this meeting to expand that, because that's a separate topic. We have to do it by Open Meetings Act, has to be posted to do that. We can't just do it on the fly.
So we can't pay them?
We can't pay them the $782.14. That's why we're removing it from the
Okay.
invoice. But then at a future meeting, presumably next month, we will expand that allocation if that's what the board's direction is to be.
Okay, so that comes up in the future. The other thing that I question is that the I mean, these organizations operate on a shoestring, and it seems to me, is it really, really this important to go back and get the new invoices from Egger? I mean, can't we just, they're within their allocation, there's a confusion, can't that be corrected after the fact?
I think knowing how auditors can be when it comes to after the fact invoicing, I think we should do it just as was suggested. We'll ask for the new invoices, we're splitting out the outpatient, and we just approve it next month. I'd rather do it. I do want to get them the monies. I want to do it legally, though. And again, we have to be audited just like anybody else.
It's not illegal, though.
I didn't say, okay, maybe that's the wrong word.
Maybe it doesn't achieve the highest ideals of accounting. I totally get that. But it's not illegal.
Okay.
You know, it is just, you know, it is, but it is, I think, difficult for these organizations, especially to operate anyway. And it seems to me it would be better for the residents and better for their patients and better for the organizations if we clean this up after the fact and just explain to the auditor. I mean, there's nothing nefarious here. There's nothing, money is not missing. There's not anything bad about it. It's just the columns were a little bit off, if you want to say, or something like that.
Okay. Thank
That's
you.
my discussion.
Any more discussion from board members? All right. We'll have a vote on the amendment to the financial report first. No other discussion. Secretary, please call the roll.
Adame?
No.
Auger?
Yes.
Connell?
Yes.
Corns? Yes. Harney?
No.
Avalar?
Yes. Okay, now with the a motion amended, we will now have the roll call. Any more discussion on the amended motion? Hearing none, please call the roll.
Adame?
Yes.
Auger?
Yes.
Connell?
Yes.
Corns? Yes. Harney?
Yes.
Avalar?
Yes. Is approved. Make sure the minutes reflect the amount of the total monthly expense with the subtractions. Thank you. All right. We're now going to move to the service provider presentations. All of us are looking forward to this, and we're looking forward to questions and answer. I'm going to ask that the presenters please limit this to 3 to 4 minutes, just to allow for time for questions. We have 10 people presenting tonight, so I'm understanding, and I understand there's a ball game that's going to start in a little over 45 minutes. I think some people want to see that too. Therefore, but please, if you can keep the presentation to 3 to 4 minutes and then allow board members to ask questions. We will begin by the Association for Individual Development. If you'll please take the podium and discuss your presentation. And please take your time. Please state your name for the record so we can capture it for the minutes.
Hi, I'm Deidre Trout-Anderson. I'm the Director of Behavioral Health at the Association for Individual Development. So I'm the Director over Behavioral Health for Elgin and the Northern Thames surrounding areas. So this evening I'm here to present our application for a community case manager through the Dunny Township. I have been here for countless board meetings and heard the dedication that you as a board have brought to the township already for accessibility for those with mental health or developmental disabilities throughout the township. There has been constant discussions about transportation for those with disabilities and the fine work done by the board to aid with those barriers. Assistance with getting Johnny, a 21-year-old resident of Dundee with developmental disabilities who needed a ride to work. I'm here to advocate for Johnny's mom, who drove Johnny to work because they couldn't get a ride couldn't get ride in came to come consistently to take Johnny to work. Johnny's mom is now suffering from major depressive disorder due to a lack of social supports, assisting her son with his barriers in young adulthood. Johnny's mom can't navigate not only options for her son that are looming, but as he is aging out of options for his care, but options for her as well to get mental health support that she desperately needs. She called the hotlines only to get a laundry list of resources that half the numbers are disconnected and the other half are not options due to insurance constraints. She called the intake lines. All have wait lists 6 to 8 weeks for just an initial assessment to even be considered for treatment or services. Now she spent half of her day trying to navigate the systems of care, so why bother trying to get help for her own? This despair is a consistent emotion felt by those seeking mental health supports, and has been a core component of why those with mental health struggles don't seek out support. Findings from the Dundee Township Needs Assessment quotes, lack of knowledge about existing services, cost of services for all income levels, stigma, long wait lists, and no public transportation are barriers for accessing services. The negative impact of looking for help when needed is only to be more overwhelmed trying to get mental health support is a foundational reason why those with mental health disorders don't seek out assistance. It's less impactful coping with the symptoms than triggering a depressive episode, being let down by the third therapy provider that can't see you for 3 months and will still cost a $50 copay. This community case manager can meet Johnny's mom in her home in Dundee Township, assist her with a routine for ADL to manage depression, routines, calendars, check-ins. Here, Johnny's mom, you dry the dishes while I wash them, since you are too tired and depressed to find the motivation to do them on your own. Johnny's mom sits with a damp dish towel, talking to mental health provider of case management as they wash the dishes, and she begins to weep, overwhelmed by the consistent struggles navigating our systems. Then Johnny's mom is standing there with the community case manager, engaged in a therapeutic interaction, not only releasing built-up angst from navigating those challenging systems, but also had someone in her home to help her wash their dishes with her, call that intake line and confirm if they can assist with the insurance coverage Johnny has, and look into telehealth therapy for Johnny's mom to start when she's ready and willing. To wrap up this encounter, the community case manager said they will come back next week and see what needs to be addressed then. Johnny's mom was able to pick up Johnny from work, knowing that a bit more pressure is off her plate, taking the Dundee Township case manager available to assist with the broad spectrum of needs faced by families who have loved ones with developmental disabilities or experiencing a severe mental health crisis. Just this morning, I received a referral from IDHS for someone in need of case management in Carpentersville. My intake will call them and tell them that we, unfortunately, have a minimum of 6 to 8 weeks to start services because for the first time in 5 years that I've worked in this area, we have a wait list. If the board approves this position, that referral would be contacted and informed of the wait list, but provided with information about this case manager funded through the Dundee Township Mental Health Board and can assist them as soon as next week. This is one referral of many, but please ensure that all of those in need of support in your township are given options and opportunities that this case manager can provide.
Thank you. Any questions? First off, Ms. Began, anything to add to this before we begin? Any questions from board members? Mr. Auger.
Who is your contact at the Elgin Township Mental Health Board?
My contact?
Yeah, you cite in your one of your answers that you're working closely with the Elgin Township Mental Health Board.
So we have a community case manager in Elgin Township. So
who is the Elgin Township Mental Health Board member or members maybe that have experience with this? Is there a board member such as ourselves?
All of them do. They all approved that grant-funded position, and they've approved it for another year. So I'm confused. What do you mean by what board member?
I was looking to reach out to them to get their impression.
Any of the board members can most likely tell you. We have been working with this case manager. I think I sent flyers for the example of what we give to individuals seeking that service. So I'm at the Elgin Township Mental Health Board meetings every month too. So I know Amanda Teachout is the coordinator. And then there's several other board members. I know we were working with the township supervisor. Fern now is taken over, but Ken was working with us to help provide like open office hours for this case manager in Elgin. So,
Okay.
Okay,
sorry, I was
very
confused
good.
about which specific.
All right.
No,
Sorry, I wasn't more direct
There's
too.
a whole board.
I think this is also, we're talking about an expansion into Dundee Township.
So
And it's
I
just a matter of the
requested-
history, right?
Yeah, so I requested like a half case manager position. So that would technically be like a case manager who doesn't bill for Medicaid for those services, but they're able to go out into the community and report back on those interactions. I think I provided like the tracker that we use for outcome measures in Elgin Township. And so that also helps because now after doing that for a year, we're able to see like, okay, this time of year, we have more people that are kind of in need of like MyHeap assistance or referrals or resources in that area. And so that's been really helpful too. And I just feel like it's a really great opportunity to break through some barriers for like wait lists and really can help, you know, even the police social worker have a referral source to be like, hey, I'm overwhelmed with like maybe just trying to tag down referrals for individuals, and so this is what this case manager can do. And then obviously transportation is a big issue, so they'll go into individuals' homes and meet them there.
Okay, good. Any other questions from board members? If not, thank you so much for your presentation, Ms. Trout, and we'll go from there. Thank you. Next presenter will be Brightpoint, or presenters. I'll make sure I see your application.
Is that okay?
That is fine.
Yeah. What's your name?
I'm Megan.
Megan.
Malloman Green.
Say it again.
Megan Malloman Green.
Malloman.
I can spell it for you. A little long one.
Is there an E at the end of green?
L-A-L-L, no. It's
Oh.
like the color. That
Okay.
was really easy.
I thought you were gonna throw me for a loop. L-A-L-L?
Yeah, E-M-A-N.
E-M-A-N. Thank you.
Your name?
Margaret, last name is Waugh, W-A-U-G-H.
Very good. All right, as before, please, you have up to 3 to 4 minutes for your presentation, and then questions. Please proceed.
Okay, well, good evening. Thank you so much for giving us this opportunity to speak with you. As I said, I'm Megan Malloman Green, and I manage mental health and disability services for Brightpoint's early childhood education programs across Illinois. Brightpoint's formerly Children's Home and Aid, and we've been serving at-risk families in Illinois for over 140 years, and over 30 of those years have been in this township. So we provide comprehensive early childhood programming, including early Head Start, and doula services in this township area. In Carpentersville, we have a beautiful state-of-the-art early learning center where we can service up to 149 children, 6 weeks to 5 years old. We also have a home visiting program in this area that can provide 20 additional children and pregnant women with services. We provide prevention-based services really through Brightpoint, and they're family-centered. We believe that strong families create thriving children. And we really want to prevent small problems from causing life-altering crises for the families that we service. So we also know early experiences can really impact lifelong outcomes in children, and children facing trauma and instability can really impact their ability to learn, to form healthy relationships, and even to grow, which is really why mental health is so central to the work we do in early childhood. In Head Start, we are able to provide some comprehensive mental health services, but they're very finite. We do this in contract with a mental health consultant. However, when our mental health consultant suggests that our families or children need extended therapeutic supports, we have to provide them with a referral to a community provider. And there is a critical shortage, really nationwide, for providers that are able to provide mental health services, particularly to children under the age of 6 who aren't experiencing developmental delays. Our families experience so many other barriers, from cost, insurance, travel, stigma, even fear. And so with these complex mental health challenges, we've really made it our mission to find ways to break down those barriers so we can streamline those supports to the children, families, and staff that we serve. And so we're here tonight requesting funding for an additional therapist to work as part of our Bright Futures program in Carpentersville. And Margaret is going to tell you a little bit about that.
Yes, I think you've read a lot about the details of the program on the flyer, but also in the proposal. So I'm just going to highlight a few things. We've been operating this program for about 2 years. We actually just finished year 2 a couple days ago. It started out as a 5-year grant from SAMHSA, which is a federal mental health grant. So this is an infant and early childhood mental health program. Megan talked a great deal about why we need that and what it does. Trauma is the main thing that we're addressing. So this is dyadic work between a parent and a child, and the trauma for the treatment comes that way, but we also do support groups. But what's really fascinating about this program is not just child and family based. We also look at the other adults that are interacting with the children. So we do a lot of support with teachers and other early childhood staff. We do specific trauma training so that they can recognize and respond appropriately to trauma in the classroom. So it's multi-tiered. All of our therapists are bilingual in English and Spanish, and they get 18 months credential and CBP, which child parent psychotherapy. So it's a very specific model. There's a lot of, we take fidelity to it seriously. And then the embedding in the centers is really why this works. From the time that we started, we didn't have trouble with referrals, we didn't have trouble accessing families, because Megan's team and all the teachers, they trust that little community that they're part of, so we're just right there, and we've been able to access them very easily, and there's a lot of participation. And then I just want to talk just very quickly to my last point. We treat traumas that have already happened, but by working with parents and other teachers, other staff, we also identify and respond to and increase protective factors against further trauma. So we really do change, through this work, the trajectory of a family.
Okay. Thank you. Any questions to the board?
I'll ask a couple.
Go ahead.
When you say childhood trauma, you're dealing with children, what, like 0 to 5? Is that?
Yes, 6 weeks to 5 years old.
So what type of trauma do you typically see?
So it comes in multiple categories. We have kind of big tree trauma is how we sometimes talk about it. So it could be children that were exposed to violence in their home.
Okay.
Maybe there was community violence. Folks that had immigrated from another country, and that journey was difficult. Maybe sudden death or loss of a parent. That's what we put in that category. But we also, sometimes kids are responding to things like, this is not a real example, I'm making this up a little bit, but got bit by a dog. So there's fear of that, especially at that particular age. And so we deal with that. Also, a parent's trauma can be impacting the way that they parent. And so this model really specifically, we learn about that, we assess that, and we bring that into treatment too, because we understand that children are still influenced by their parents.
Okay. So then the second question is, just for my understanding, the clients, the children that you help, are all clients that are part of the Head Start program? Is that kind of the pool that?
Yes. I did not say that explicitly, but that's exactly right.
Okay.
These are children and families enrolled in our programs at Bright Point.
Okay. So they've got to be enrolled in your program to be considered for the Bright Start program.
Yeah.
Okay. Any other questions?
A comment?
Good. Member Auger, you done? Okay. Member Corns.
I guess my question is, how have you guys been impacted by cuts in funding recently?
That's a great question.
Well, I'll speak to Bright Futures.
Yeah.
We have a 5-year SAMHSA grant, so far we have our year 3 award already, so far that's been untouched. We are absolutely monitoring it all the time, as you can imagine. Head Start is a little bit different.
You know, and being a large organization, we're secure, and we have our funding for Head Start as well, but we're constantly monitoring that as well and trying to keep our families and our staff feeling secure. That's causing a lot of insecurities for staff as well, which is also why Bright Futures is so helpful to have a therapist on site who can just be present. Our staff are dealing with so much first and second-hand trauma. So,
I just want to add that I was really excited to see your application come through, because I've seen some of the work that the one in Schaumburg has done in people's lives, and then I've got family who's personally benefited from the services you guys offer in Carpentersville, and so yeah, it's great to have you here. Thank you. Yeah.
That's the best compliment.
Yeah.
Okay. Any other questions from board members? I have a couple of questions myself. I'm looking at your service capacity, and you've got 12 clients for last year, 12 clients for this year, and you expect to increase fourfold with this funding. Can you help me explain that when I know you have nearly $2.5 million from Head Start? I mean, how does our funding help you grow that exponentially?
Yeah, those numbers were based on not having a full-time therapist there. So Head Start, because our agency is big, we were just able to fund a full-time position as of July in Carpentersville, and we're asked, so that number will increase pretty dramatically. I think you have the number about, like, already, we went to half the number of referrals that we did in the whole previous first year, 2 months in.
So the referrals 2 years in, you have basically have a waiting list of.
Yeah, it will get there very quickly.
Very quickly.
And so this is an additional full-time position. So we can expand, we can do all of our services, including teacher support, but then also it's just more capacity to families as well.
Okay, very good. Obviously everybody's, particularly SAMHSA, and of course with the reorganization of Health and Human Services, how that's going to be under the new organizations to be determined, but you've gotten your year 3 of, so basically you have a $500,000 grant. I take it you receive $100,000 per fiscal year from the feds.
It's $500,000 per year.
Oh, it's $500,000 per year?
Yeah, we have the max.
Okay, so you had a, okay, very
So
good.
that's why that's how we're only talking to you about Carpentersville, but we're at 5 sites across the region.
Got it. Okay, that makes sense. Any other questions? If none, thank you very much, two of you. Thank you all. I will ask Lutheran Social Services of Illinois to please come to the podium to present. And again, I know I didn't watch it too good, but there were 2 speakers last time, so please take no more than 4 minutes for the presentation. You have a handout?
Absolutely, I do.
And please state your name for the record.
Yes. Good evening, everyone. My name is Holly Holliday. I am the Senior Director of Substance Use Services with Lutheran Social Services of Illinois, overseeing our substance use programs in the Chicagoland area, including specifically our Elgin location. At our location in Elgin, we have 3 primary programs that are running out of that program. We have a 28-day residential rehab program, outpatient programming with intensive outpatient and outpatient substance use services, as well as a recovery home that allows individuals with a substance use diagnosis to live there for up to 1 year to help stabilize and be able to return to more independent living. 2 of the primary barriers that we face at this location are the lack of funding for people who are uninsured and the regular occurrence of bedbugs. With this funding, we would be looking to serve more individuals that do not have any insurance or funding, as well as improve the living conditions of the program overall. We, as a collective program, recognize that many individuals who are looking for substance use services have a hard time paying for those services and being able to financially afford those. The services that we provide overall meets the goals that the board, you all, are trying to make, including ensuring that people have access to quality and affordable care. As a whole, we do provide a fairly large amount of services within our recovery home. We've served 99 people within this last fiscal year, and we've had 438 people complete our residential treatment 28-day program. Roughly 25 of those people are originally from Dundee Township. However, we do notice and recognize that even though there are people who are starting seeking treatment that aren't always initially residents of Dundee Township, oftentimes with the recovery home specifically, they're living there for a year, and this is their transition into becoming a resident of Dundee Township. And we also have people in our residential program who, after completing treatment, are recognizing that they're looking for change in their life and that this is the area they want to restart their life. And so this is a great opportunity for us to hopefully be able to help support people make those changes in their life and to restart fresh in an area that feels more like home to them.
Okay. Thank you. Any questions from the board? Member Auger.
Yeah, I guess I'll be the designated question asker. So I guess one of the things that I'm not sure how to navigate here is we utilize our funds for Dundee Township residents, and it's not clear to me whether the services you provide and what we would be providing you a grant would be used for Dundee Township residents. And, I guess in particular, the furniture.
Yeah.
So I guess I'm trying to understand how to process all of that and make a decision.
So with the furniture with the bed specifically, there wouldn't be a way for us to necessarily designate certain rooms for Dundee Township residents. However, because we're serving 438 people in the residential in that year, at some point in that time frame, there would be Dundee residents there. It's not always exclusively Dundee residents, but we are, roughly 25% of them at any given time are residents when they start services, let alone as they're continuing in it. That being said, if it's not an option for the furniture, we would plan to use that towards providing the funding for services, and that was something that we could track and ensure that's only being provided to Dundee Township residents. We do track the addresses that people are providing at the time of their intake, so we would be able to verify their residency as a way to ensure that if it was funding being provided for uninsured individuals, that it would only be going to residents.
Okay. And I guess final question on this topic. Do you have any grants coming in from other local 708 boards that would be helping to pay for this furniture? I guess I'm not opposed to pay for it. I'm just, kind of look at how do we pay for our portion of it.
Yeah, at this point we don't currently have any other grants or anything with 708 boards for this.
Okay.
Okay. Any other questions? All right, I'm going to be designated hitter too. I know these baseball terms, I know people are looking at that. Service capacity, according to your application, you are currently servicing 134 Dundee Township residents. Is that all substance abuse, or is there other treatments at your places that your agency is doing?
So with this program specifically, this is specifically a substance use program location. Lutheran Social Services as a whole provides a very large variety of different services, and so there are other programs that do this within the state of Illinois. Offhand, I can't think of anything specifically in Dundee Township other than our substance use program.
Okay, let me rephrase a little bit then. So I'm just looking at the numbers, and obviously, as Member Auger said, we want to ensure the benefits are going to Dundee Township residents, because that's what we're about, is Dundee Township. Therefore, according to your numbers, you have about a quarter of your program clients are Dundee Township residents.
Correct.
And they're all being treated for substance use.
Correct. So they're not all of the individuals that we're serving, that 438 for the residential and the 99 for the recovery home, that's spread throughout this fiscal year.
Okay.
And so our facility as a whole for our 28-day residential program is a 30-bed facility. The recovery home is 22 beds. We have outpatient programming that's connected to the recovery home as well. So those are also community-based services that are not necessarily counted as part of those beds. And so at any given time of that collection of people, 25% of those come into services as a Dundee resident. For the recovery homes, because the intention is then to live there up to a year, many of them are then changing their addresses and making this their official residence, where they then would be coming as residents of Dundee Township.
Okay.
So that is separate from that 25%. The 25% is specifically those who are coming into services starting off as a resident.
Okay.
Not necessarily.
And certainly, if it has to be amended to a fee for services, that would include both inpatient and outpatient treatment, as long as they're Dundee Township residents.
So we have the inpatient residential, which is the 28-day. We have outpatient, which we have IOP, more intensive, outpatient, a little bit less intensity. And then the recovery home is not specifically a treatment program. It is connected to the outpatient programming, but it is a space where there's the support of staff and other people who are also focused on living in recovery. And so that is the 99 people in that recovery home program.
Okay, very good. Any other questions from board members? Thank you very much.
Thank you so much.
I will now call the representative from Stronger Therapeutic. Please come to the podium and state your name for the record.
Good evening. My name is Kelly Jacobson. I'm the founder and clinical director and therapist at Stronger Therapeutic Counseling Services, and I have a flyer for you.
Thank you.
Thank you.
Thank you.
Thank you very much.
Yeah, thanks. Well, thank you for having me tonight. I appreciate the time that you put into our community and the time that you're extending to me this evening. I am enthusiastically ready to share with you about a new program that my practice is excited to launch in 2026, and it is our Strong Foundations program. So let me tell you a little bit about myself and our program, and our practice, and how we see Strong Foundations fitting into that. So obviously my name is Kelly Jacobson. I'm an LCSW, and I have a master's in educational leadership. I spent the foundation of my career over close to 15 years as a school social worker and school administrator in West Aurora School District. It was my goal as a young professional to become a social emotional coordinator for our district. Unfortunately, our family took some changes, and I moved towards opening Stronger Therapeutic Counseling Services. So with a strong social work and school system background, I've built Stronger Therapeutic Counseling Services since 2017 into 2 locations. So our second location is here in West Dundee, where we've been located and established for the past 4 years. We just celebrated in June. Our business has been established since 2017. And among the services that we offer at Stronger, individual therapy is our primary service. So we support individuals with anxiety, depression, relational stress, trauma, school and work stress. And as an extension of that, coming from the school system, we also offer workplace wellness services so that we can support individuals in their workplaces, gaining the education, skills, competencies, and developing healthy workplaces and cultures as a result. So from there, we have taken a very educational and collaborative community approach for outreach, where we connect each year to 2 big events for the past 5 years. So our Brave and Strong event is a collaborative community mental health action campaign that we've done in both our Batavia and our West Dundee locations, where over those 5 years, we've raised over $8,000 to support individuals experiencing financial hardship in either of our locations so that they can maintain and potentially begin therapy services, removing the barrier of financial circumstances to continue and support their mental health needs. Additionally, in May, during Mental Health Awareness Month, we also host a Your Stronger Self event. So for the past 5 years, we collaborate with a local restaurant or boutique or store and invite in community members every year free of charge to have an evening where they can meet therapists outside of the therapy room. We give a mental health pep talk amongst our team to the attendees that participate, and it's really a time for community building, connecting, and collaboration amongst community members to kind of have some heads nodding of, yes, I understand, I've been there myself, or yes, that sounds like something I'm currently going through. And so from those events and from our Brave and Strong mental health action campaign, relationship building is really the core of our business to support the communities that we're a part of. Our Brave and Strong campaign, we've had 13 local businesses partner with us to sell t-shirts or sweatshirts in their stores or their boutiques. And so truly I feel as though the partnerships that we make are mutually beneficial so that they are, joining us as an ally and an advocate for mental health awareness, and we are able to share the opportunity to gain resources to support our clients and remove the barrier of finances to maintain their mental health services. So one other distinguished award I'd like to share with you is supporting my own team is very important to me as we support the teams of others. So for the past 2 years, we've also been awarded the Silver Mental Health Bell Seal Award, which recognizes us as a distinguished business amongst other businesses that apply and reach those standards for ensuring that their teams are receiving a opportunity to receive. Sorry, I can't speak at the end tonight. But all of the criteria that we have to submit to receive that distinguishment shows that our team has opportunity for a positive team culture and ultimately cares for the mental health of the employees that are working with us. All right, so I'm going to take you a little bit through our Strong Foundations program.
Okay, you're starting to get to the time limit here, and I just want to,
Thank you.
if you just very bullet point, very high level, please.
Okay. Well, you have the highlights in front of you. I'm just going to share in regards to our program overview. It would be in regards to case management services so that we can add an additional service within our practice to assist individuals within the community, not just Stronger, with necessary services to help the psychological safety, physical safety, and increase our community members' ability to move up, if you will, through the hierarchy of their own needs and maintain services through the therapeutic process. As I've said, collaboration has been a big part of my business, and I see the Strong Foundations program as a collaborative community approach where we're able to take a warm hand and guide to the services that are required. As service providers, we know that the strongest indicator of success in the therapeutic process is the relationship with the therapist, and being able to connect community members to resources within our community through a strong relationship is how I see our program being able to support the Dundee Township.
Okay, very good. Any questions from board members?
I do.
Ms. Dame.
Yeah, I'm just curious, do you keep track of how many case management hours you're spending outside of individual therapy clients currently?
I don't keep track. Yeah, I would say at this time it's all been just kind of as it's needed within our own client base. And so that's where we've seen a growing need, and those are not billable hours as we're only contracted with insurance providers, private insurance providers. And so as an employer, that time is extended to my team. And obviously if there's a growing need in my practice, we're seeing that within the community and want to be able to support it as well.
And do you happen to have any services in Spanish? Do you provide better services?
Not at this time.
Thank you.
Okay. Any other questions, Member Auger?
Yeah, I just want to confirm. So you've presented a lot of things that your practice provides to people. The grant application that you presented, though, is for case management, correct?
Yeah.
So you would be providing, would it be fair to say you're going to provide similar services that AID presented earlier?
Yeah, I would say similar, yes. In
Okay.
regards to supporting clients gaining access to services within the community, resources within the community. Yeah.
Okay, very good, thank you.
Any other questions from board members? All right. Thank you very much.
Thank you.
Thank you so much. I will now ask the representative from Ecker Center to please come up. I recognize that you have 5 programs that you've applied for. I'm going to ask you to, though I'm going to keep you on the time limit for the entire agency.
Trust me, I'll be fine.
So very good.
Thank you for having me. My name is Kim Pettit. I'm the Grants Management Director at Ecker Center. And briefly, I'm just going to go over a little background on why we're asking for these 5. So in 2022, we applied for a Certified Behavioral Health Clinic Planning, Development, and Implementation Grant for SAMHSA. And we were one of 151 organizations nationwide to receive this 4-year grant. known as the CCBHC. The CCBHC model is an integrated approach to delivering behavioral health care that aims to improve service quality and accessibility. Some key features include 24/7 crisis services, coordination with primary care, evidence-based, trauma-informed, and recovery-oriented care. We had to do a lot in order to transform from a community mental health center to a CCBHC. We updated technology, which included computers, a new electronic health record, added programs, such as supported employment, new crisis programs, 24/7 crisis programs. We completed a community needs assessment. We've done a lot to transform. And we're really excited about integrating the CCBHC model into our organization. Currently, there are only 19 CCBHCs in the state and 500 in the country. The model is considered to be the most transformative shift in behavioral health care in the last 3 years. And we're very proud of being part of this movement. So what that means, when we applied for 5 different things, we are running out of space. We need capital funding. We've had to add so many programs and we have nowhere to go. When we saw that there's an opportunity for capital, we were excited about that. So we were asked for funding to help. We had to buy a new building to move our administrative staff into a new building. So it's in not great shape, and we're just hoping to get some funding to help make it livable. Most importantly, though, we were asking for funding to support outpatient behavioral health and crisis care for the individuals living in Dundee Township that are either uninsured or underinsured. So there's no out-of-pocket fees for any of them, which is part of the CCBHC model. Service regardless of the ability to pay, and that's the most important. A huge barrier that we find is transportation. And when we saw that there was an opportunity for transportation, we thought, what a great opportunity for us to ask for Uber cards, taxi fees for clients that are coming to Dundee Township for our psychiatry programs. You can do telehealth with therapy, but you have to come see a psychiatrist. So we thought that was a great opportunity. We'd love to see all of the options. And then lastly, the Boys and Girls Club. We had a little late start on it, but it is really blossoming. And they're so excited with the programming. Our therapist is doing a great job there. So we hope to continue that at least through the end of the school year.
Okay.
That's
very good.
Questions for me?
Thank you. Questions from the board? John?
I've got a couple that I'll ask.
Go ahead.
So the capital funding, what percentage of this expansion is going to be directed towards Dundee Township?
Well, when I heard you ask that question to someone else, I realized that was probably going to be a challenge. So, and that's not our priority at this point. Like, number one would be providing funding for outpatient and crisis services. Mm-hmm. That's number one, for sure. And if you consider transportation, that'd be great. I can't tell you how much would be for Dundee Township. In the past, when we've applied for capital funding, it's based on, I've never had to base it on like the number of clients that we serve, because it is capital funding. Our whole organization serves Dundee Township, but I can't tell you how many clients are involved.
Okay. I mean, what other 708 boards make use of Eckert that you could reach out to help?
Hanover Township has a capital funding that we pretty much use every year.
Okay.
So last year we reached out to them and they did fund us to help us with our new building for new furniture. We've added probably 40 new staff, and last year we're going to have to add another 30 to meet the requirements of the Illinois CCBHC program, which is a new, it's new, like 24-hour behavioral health clinics. There's a lot that we have to do in order to meet these requirements.
Okay.
So anytime we see the Community Foundation of Oxford Valley, they have capital funding. It's very rare though. So, and I know probably other organizations are also like seeking that funding because it's so rare to find it.
Right.
Okay.
Then I guess the second question I have is, why won't ride and cane suffice for transportation? We have a program. It is supposed to provide services to Dundee Township.
Yeah.
Why can't that be used?
Sure, it's great, except for some of our programs go beyond the hours of operation. We have substance use programs that go to 9 o'clock at night.
Okay.
It's easy. It's hard for people when they have an appointment for a therapist or especially a psychiatry provider. If they can have a dedicated Uber ride, it's easier for them to get there, and there's barriers so limited at that point. Rather than having to figure out a ride and cane. And I've been asked that by actually the Hanover Township Board has asked the same question.
Okay.
Elgin Township as well.
Can I address that?
Go ahead, Member Harney.
I sit on the township board and I was a supervisor. Ride and cane is simply not reliable. I wish it were. We try hard to make it reliable. It has to do with a number of issues. Many good people work hard to try and make it work, but it doesn't. And it has to do with, for one thing, the billing cycle is over 60 days. So, someone rides on a ride and cane ride, and the taxi service or the bus service submits an invoice to PACE. And I think it has to go through Kane County, and then it dribbles up to PACE at some point, and 60 days passes really quickly. Yeah. The township, we get the bill for our part anywhere from 3 to 5 months after the ride is given. Yeah. Right. And so it is a product of many different funding demands made by federal, state, and local people. Believe me, there is no one on this board, the 708 or the Kane County, ride and cane thing, that hasn't looked at this and tried to make it better. Yeah. PACE is the same way. It's just a cumbersome thing that doesn't work very well.
Well, and imagine if you're a person with several mental illness disabilities and trying to manage that. It's literally impossible.
Okay.
Well, we've had multiple clients at the township who are disabled, and they have a job. So it's a regular, whatever time it is, and these days and everything. And they would be left standing on a corner or standing outside a store in the winter when it's cold, and their ride just didn't show up.
Okay.
And so then we've got a parent at 9 o'clock or 10 o'clock at night or something like this. And I wish I could say it were better. I wish I could tell you how to fix it. I've worked with it. But it's just not a reliable transportation system unless you have a lot of flexibility.
Okay, and we will definitely look at that.
During the day.
I want Member Auger to be able to complete his questions. And then,
No, that was it.
Okay.
Those two.
Okay, thank you for that. Ed. Any other questions from board members? All right, I do have a couple of questions. Uninsured. How can you be having uninsured with the changes in state law that all health plans must carry mental health coverage?
Okay.
Are you still having people that don't have coverage?
Sure. Yes. Yeah.
Okay, so basically they have no coverage, not even through Medicaid.
Right. Exactly.
Say again?
They don't qualify.
Right.
They don't qualify for Medicaid, and they can't afford the insurance.
Their documentation status.
Okay.
Or think of this: there's a 26-year-old, a 24-year-old that comes in that has insurance to their parents.
Mm-hmm.
It's Blue Cross Blue Shield, and we don't have that. We don't take that. But we can't. We don't have that panel, and they don't have Medicaid.
The best insurance.
What?
It's like the best insurance, Blue Cross Blue Shield.
Not to mention a
We
significant.
have MCOs.
Right.
We're community mental health centers. We're not a private practice.
Okay,
So-
that's a good point there. All right, I just thought when the
Yeah,
General Behavioral Health Act was passed in 21 and in 23, every plan carries mental health coverage, including Medicaid and Medicare plans in this state. They're supposed to carry mental health coverage, but people can't afford it. So that is still a problem versus, because I know in some other agencies we've seen the numbers of invoices go down because more people have insurance. That's why I didn't realize Eckler was still having that issues with uninsured. Okay,
Or
and that's
underinsured.
okay, underinsured I can understand that, but uninsured I thought was supposed to be a thing of the past.
No, we still have underinsured.
All right,
We have
apologize for my
now.
naivety and silly me. Okay, final question. I understand you're one of the few agencies that has its own on-site pharmacy. Is that still true?
We have Genoa Pharmacy on site, yes.
Okay, are they a standalone pharmacy benefit manager?
They are standalone.
Okay,
They run
so with the reforms that were just passed in Springfield that should be taking effect at the 1st of next year, is that going to impact your patient's ability to get meds, either more difficult or less difficult? Has that been taken into account in what's going on in your applications?
Well, they're a standalone organization. They rent space in our facility, so I'm not quite sure how that's impacted them.
Okay, or will, because it's
Yeah.
not fully implemented yet,
Right.
but that's something that's been pressed in the state, and that was one of the few things that passed with almost unanimous support in Springfield this
Yeah, that's
passed
interesting.
last year.
wasn't aware.
I'm sorry, earlier this year. So that's something that we've been tracking diligently through ACMI, through Association of Community Mental Health Authorities of Illinois. So anybody that has an on-site pharmacy through a PBM, what is the impact? Should be positive.
Right.
It's supposed to be positive. They're supposed to make it less expensive, and obviously more of the rural independent pharmacies are supposed to be protected under the Illinois law. But I'm just curious, since you have an on-site pharmacy, if you have assessed that yet, and it sounds like it's too soon,
Yeah.
you are going to have some impacts one way or the other. We'd like to hear about that in the future. Okay? Any other questions from board members?
No, can I just address the board?
Member Adani.
For a second. President Avalar, you mentioned that people can't afford it. It's not that people can't just afford insurance. I just want to highlight that some people just do not qualify for insurance because of their status here in the state. And that adds to the stressor of how do I get to appointments if I don't have the immigration status to be a resident, then I can't get my license, and then I can't get to appointments. I can't drive my child who may be a citizen to their appointment. And then that adds an added stress. And Ray, you asked about trauma. That is very traumatic when you know that there are some basic needs that can't be met. And so I just want everybody to consider that as we consider the capital applications that we're reviewing tonight.
I definitely appreciate that feedback. Member Adami, I know you're much more in the front lines than I am. I'm just, when we're sold by our local leaders, and one of our local representatives was very key to those reforms of the Community Mental Health Act over the years, and I'm hearing we're still having, our patients, all patients are still having challenges with this. That tells me that is the change in the legislation working the way it was meant to, and this is feedback that through our ACMI channels, through our legislative committee, I'm on that committee, we get this to the right people, and we say if you need to amend this, do a trailer bill, whatever, we still got to help people. And obviously, immediately, it's still rough, but our job as a board is to, as we hear these stories, if we need to make something better through the state, we do that. So that's something, I do appreciate your input there. Thank you. Any other points or questions? Thank you so much.
Thank you all. I appreciate it.
I will ask the representative for NISRA to come forward and
Hello, I'm Jim Wiseman, Executive Director of Northern Illinois Special Recreation Association. Henceforth, we go by NISRA, because it is a mouthful. We are a cooperative of 13 park districts and park and recreation departments. And it's very unique to Illinois that there's actually a state statute that allows park districts and park and recreation departments to form cooperative so they can provide community-inclusive therapeutic recreation. And NISRA's celebrating 50 years starting next year, so we've been around a long time. Our services are all public. We utilize park district and park and recreation department facilities. We're therapeutic in that, yes, we are fun. That's our first core value. We are going to be fun. But through fun, we are teaching life skills for anyone from age 3 on up with a disability. We're a lifetime service. We also do trips, in summer camps. Anything you think of with a park district, we do that. Dundee Township Park District is our second largest member. And what I'm here tonight to do is to support our request for respite funding. We actually reduced it this year because we kind of overshot thinking it was a greater need than what there was, so we reduced our ask this year to what we believe It's going to take us a while to get a little bit of traction with the people who need it. Because our services are all private pay. We don't qualify because of regulation for third-party billing of any kind. Some of our families utilize Medicaid services, home service funds like that to pay for our service in that. We also have a very robust scholarship program. I have the NISRA Foundation, which is our fundraising arm, and last year the association granted over $55,000 in scholarship. Even that sometimes to a family member providing 50% off on the cost of a program, they still cannot afford it. So through respite funding, you're helping to break down that barrier of cost. And what does respite funding do? Well, it's twofold. One, it provides a respite for that individual we're serving, a respite away from their family, to be with their friends, to be out in the community, keeping their skills up, in particular for our young adults and adults. Because the question is, what happens when the yellow bus stops coming? Well, up there in school, there's a lot of interaction. Once you get out of school, those adults have very limited opportunity. That's where we come in. And so respite funding gives them the opportunity to break down the financial barrier to be a part. Also, it provides respite, and this is a key part for that family caregiver who's 24/7, 365. We have parents telling us all the time about how, when I know they're with NISRA, I know they're safe and having a good time. And I know my child or my loved one is being taken care of. And I get a chance to get a haircut. I get to go to a movie. I get time for myself, for my own mental health. So we greatly appreciate the support you've provided this year. Like I say, we're working to expand traction. This last summer, we had 2 residents' children attend our summer day camps because of the respite funding allowed them to do that. Currently, we have 2 young adults that are doing weekly programs because we operate much like a park district, and we've got 3 other people in the pipeline that we're trying to engage. So the numbers aren't great, but to that one person, it means a lot. I don't know.
Thank you.
Any questions you might have?
Questions?
No questions.
Hearing none, thank you so much.
Thank you.
I will ask the representative of Family Service Association of Greater Elgin, Ms. Bernie. It's good to see you again.
Yes, thank you. I'm Bernie May. Had multiple titles at FSA, I guess. Tripping over the cord. But I'm currently the Chief Operating Officer at FSA for 6 weeks now. So, FSA took a significant shift in how we were requesting funding this year. So this handout may be an executive summary of the 2 different requests in which we've placed. So the first one I want to reference is the dedicated therapist position. So the reason we come to you with this instead of going for a fee-for-service model, and actually this is more efficient for both you and us in terms of going in, it gives us an opportunity to have a person who's truly dedicated and understands the systems here in Dundee Township. They can link them to other service providers effectively. Think of it almost like an EAP model. People are probably familiar with employee assistance programs through an employer, right, where you can get 3 to 5 sessions, and then they pass you on if there's an additional need. Thinking something a little more similar to that type of model, right, where we can kind of link and connect, do like that heavy, intense hit on the front end. If we can resolve the issues, let's resolve the issues. And if we can't, right, then we can link on to other services from there. The other nice thing about that is, if you have somebody who is coming in currently uninsured, we can also work on the process of getting them insured in that time, right? So we have all kids in the state of Illinois. Most kids we can get on Medicaid. Sometimes it takes 2 to 3 months to get a response from the state of Illinois on a Medicaid application, which is way better than the 9 months it was a few years ago. So it's improved, certainly, but it's still like, we might have that delay, but then we can actually backbill for like after 30 days after the application. So it allows us an opportunity to then do that. So that becomes complicated in a fee-for-service model, right? When you're dealing with things like that, where you're working with that. So first position is that. The other nice thing that we wanted was that this person could be a liaison specifically to the township. So somebody could attend meetings here and provide valid information, somebody who could go to other community meetings, like with the park district, with the schools, right? Somebody who is like embedded and invested in the community. So that's that one. I'm going to move on then to actually the capital request. We would love to be able to open an office in Carpentersville. We have had historically an office in Dundee Township many moons ago. In fact, there was a Family Service Association of Dundee at one point that folded into our organization. And so that was a long time ago. When I started at the agency, I don't even remember when that was now, 13, 14 years ago, something like that. It was right before then that we actually closed our office in Dundee. And so at that time, it was a funding issue and the reason why we did that. So we have long wanted to be back in the Carpentersville area and have an office in that area. In the same way that you want a library and a grocery store in your community, right? I think having a community mental health center in your community makes sense too. So that's our hope. We would like to be embedded in the community. So this is really like a one-time request to get us set up in an office. We would maintain everything after that and manage it on our own through that. So we don't have a specific spot picked out. We would do that if there was an approval of funding and then move from that direction.
Okay. Thank you. Questions from the Mental Health Board?
Okay, I'm going to ask...
Please.
So getting a full-time person, is that person going to be able to serve more Dundee Township residents than the fee-for-service model that we have?
So I think that would open up a capacity to add additional people on, right? So I think that yes, we probably still serve the same amount of people we do in Dundee Township. This person would be an add-on, so they would open up the capacity to serve more people within Dundee Township, but they also might still be connecting, right, to the agency for more ongoing services. So
yeah, I guess what I mean is, in your past applications, we've done fee-for-service.
Yeah.
And you have billed us for however many, hours of, service were provided, and that helped X number of people. I forget the exact number, a couple hundred, something like that. Is this person going to have that same capacity, or are we going to lose service? It's like, it sounds good to have somebody dedicated, but is that going to prevent us from servicing as many people as we've been able to in the past?
No, I think we've maintained the current capacity we have. This is an add-on, right? So we would maintain what we have in an existing structure. This person could do the front-end work and then get them connected.
Okay, I don't feel like I'm connecting on my question.
It's not a loss of services.
Okay. All right, we'll go with that.
If you want a real direct answer to your question.
That's what I prefer. I prefer a very direct answer.
No, the answer is no.
Okay. Fair enough. Thank you.
Any other questions? I have a couple myself. Projection based on your service capacity. So, if I heard this right, if we were to move from the fee-for-service model, according to your projections, we're going to increase by about 8 percentage points, what you're expecting to do by the end of this year, from 220 total to 270. That's with this added person, or?
I think with this added person and a presence, right? So I think that having an actual physical presence in a community where people then see somebody and that person's connected, I think that that's really important.
Okay.
So you have to think of them as a married deal, right?
Okay, well let's talk about the other side of the aisle on that marriage, and let's talk about the satellite office. It's terrific that FSA is looking to come back to Dundee Town. Well, actually, you're physically in Dundee Township, but in the southwest corner across the tollway.
Anytime you pass 90, people don't think so, right?
Well, I do think so. I know you're there. So, when it comes to, obviously, you mentioned site selection has not taken place. You anticipate you're going to be closer to the patients that are in need. So there's likely going to be either Old Town or towards the eastern side of Carpentersville, where the need is based on all of the needs assessments that we've taken. And obviously we can't dictate where that's going to be, but you're saying for nearly $49K, that will be enough to set up a satellite office, either leased or owned. You'll plan to lease it? You're going to lease it?
We just owning property is the whole thing I don't want to ever get into.
I understand. That's a clarification there. So, with that component, how long do you think it would take? Let's just presume January 1, 26 this year. How long to 26 before we see that location?
I I mean, I'm assuming you'd notify us before January 1, right? So we can start working
We
prior
do that.
to hitting that date.
We do the.
My thought is that we can probably have a spot up and, so, I mean, we've done recent build-outs since FSA has moved recently. So I would think in a smaller office space, we'd be able to get a build-out in 4 to 5 months tops, right? So by the time we secure a location, get through the leasing process, all of that jazz, we're probably 5 months in. So maybe May.
Okay,
Probably,
so
right?
okay,
Open
so
doors
in time
officially?
for Mental Health Awareness Month. So certainly.
Great time for open house.
Okay, no, and I guess where I see this, and I remember, a few years back you requested a capital fund, and of course we couldn't support it at the time in 23. So let's look. I'm looking at this, and the one area that I'm concerned about is, okay, this is going to be much more than the presence you had at Carpentersville Firehouse a few years back.
We
This
still
is
have
not
that.
just, you still have
We're
that.
still there, yeah. We're still at Carpentersville Fire Department, yeah.
Okay, so it's going to be more of a facility than just
Yeah.
having office hours at a location. This is, you're going to have a leased place under FSA Carpentersville, whatever the name is, and then patients can more easily access your location. Okay. I just want to ensure we're going above and beyond just what you had at the firehouse.
Yeah, yeah. No, we still have that. We'll still keep that because that's part of our mobile crisis response connection with them. Because then sometimes we go out with them right on calls. So.
Got it. Okay. Any other questions from board members? If none, thank you so much. Great to see you all again.
Thank you, guys.
I will ask the representative from Easter Seals of Fox Valley and DuPage County to step forward.
I did time myself at 4 minutes, and I'll talk fast.
Thank you so much.
Thanks, Judy. No, that's fine.
Thank you.
What's your name?
Lisa Ewers, and that's spelled
Thank you.
E-W-E-R-S. Would anyone else mind sharing?
Thank you.
Okay. Thank you.
Thank you.
Okay. You got it? We got it?
Yeah.
How about Joe? Give it to Joe. Give it to Joe to share.
Like Mikey, there's 2 here.
Okay.
Oh, I got it. Oh, okay.
All right. Ms. Ewers,
Yeah.
floor is yours.
At Easter Seals DuPage and Fox Valley, we believe every child deserves to thrive in an inclusive community. It's why our pediatric therapy services aren't dependent on a family's income level or insurance plan. We accept more insurance plans than any other area provider and are one of the few supporting children on Medicaid. If we weren't here, uninsured families would have few options and hundreds of others would be left without services. Our request for funding support is to assist children with developmental disabilities and their families who are low income, uninsured, or underinsured residing in Dundee Township. Funding will be focused on those who have the greatest medical and financial needs. We are the only provider of pediatric therapeutic services to children with developmental disabilities and delays and their families in the greater Chicagoland area that removes all financial barriers to care. We're the only pediatric provider that accepts all forms of insurance, including Medicaid. Of the 25 area pediatric therapy programs, and this is illustrated on the handout, we are one of 3 that accept Medicaid, one of 5 that accepts early intervention, one of 2 that accepts private health care, and one of 4 that accepts commercial plans. Additionally, funding from granting organizations enables us to offer financial assistance for those in need. So the handout that you have, we did some research. On the left-hand side, you have the 25 area providers. We don't have their names listed, of course. And then across the top, there's 13 different insurance companies. And so you see Easter Seals up at the top. Our boxes are all green. As you see, as you go down that sheet, those green boxes get fewer and fewer and fewer. I believe the last 3 on there only accept Blue Cross Blue Shield PPO, and then the last 5 only accept private pay.
Okay. Very good. If there's nothing else, questions from the board?
Surprise, no?
Okay. Okay, thank you so much, Ms. Ewers. I'll ask the representative from Pivotal to come to the podium, state the name for the record.
Lindsay Kyson, Director of Pivotal Counseling Center, and I have 2 programs to present. So I will start with the Minds Matters program, which you guys have funded this year, with some updates. The program is actually going very well. We have put in a request for the exact same program, CASA funding. That actually matches the data so far of what we've been able to book. With presentations out in the community about prevention, mental health, we've done topics around ADHD, care for the caregiver. We've gone into businesses. We've made connections with local libraries, and that's been going very well. I wanted to let you know, I've had this conversation with Jarrett. One thing that we've seen is they want to book these things 3 to 6 months out. So we are already booked for 5 of them in 2026 as an example. And we expect to be able to more regularly be able to book them. So we have cut our funding request mostly because we want to be good stewards of your dollars and say this is what we're seeing as the actual frequency right now. I suspect demand could grow, but going into next year, I feel confident that we can hit the numbers that we put in that application. So far, we've had touch points with just shy of 400 individual attendees for our presentations in Dundee Township area. I will move on to the next program. So we, our Pivotal Access program, so we are an outpatient counseling group practice. We are designated as a behavioral health clinic in the state of Illinois, which means that we take all forms of Medicaid and our staff take Medicaid as well. We also take all commercial insurance, and we also accept Medicare. So we take just about anything that somebody actually has if they walk through the door. We have current capacity. I know Member Adame will ask this question. We have been able to hire a Spanish-speaking therapist in the last year, so we're still on our mission to hire more, and we'll continue to try to do that to provide that service. The Pivotal Access Program is focused on meeting the need of what many people here today have talked about, which is if you're a case manager or if you're a short-term touch point, where do you send them then? And we want to be that place for uninsured individuals to be able to use those dollars. And then we want to bridge the gap for underinsured individuals. So program dollars for people that using a typical sliding scale form, depending on poverty level, what they report, number of dependents in the household, would be able to qualify. So if I have Blue Cross Blue Shield, but I have a $7,000 deductible, and anywhere I go, it doesn't matter if it's me or somewhere else, the rate's going to be the same. If I can't afford $130 every single week for care that's beyond 1, 2, 3 sessions, I'm just simply not going to get it until I have a crisis. And we want to avoid those situations. So in order to meet people where they're at, what we are asking in our underfunded category is that they would be responsible to pay us the portion that they would pay once their deductibles are met with their in-network insurance. And then the other dollars would be for Dundee Township residents supplemented until they hit that number, and then we will migrate them right into their benefits for the remainder of the year. So a program like this, we would expect to have most demand early in the year, because like all of us, most of us don't hit our deductible until a couple months into the year, unless we have real high deductible plans. So this will be for unfunded, this will be for underfunded, and it is fee for service because we want to be able to access every one of our therapists. All of our therapists have different specialties, different training. We are a trauma-focused counseling center with 12 of us trained in EMDR, which is evidence-based treatment. And we have a number of therapists that specialize in the littles, going down to 4, which is also a big demand. So our hope is that we'll be able to attract Dundee Township residents. We will connect with every case manager that we can find that is looking for a place like us to send people to. And that we will bridge that gap for that underfunded population, which quite honestly, I haven't figured out the legislation to fix that one yet. So I feel like we have to fill the gap. So I'll stop there. What questions do you have for me?
Questions from the board?
I have a quick
question,
yeah.
Ms. Dami.
Lindsay, do you mind telling me where do you meet with Dundee Township residents?
So we have 3 locations. One of our locations is Elgin. It's 31 and 90. But then again,
That's in Dundee Township.
Dundee Township. And then we also have a location on the Algonquin side, Lake in the Hills. So we actually see quite a few Dundee Township residents because our locations are about 16 to 20 minutes, depending on traffic, away from each other and everybody else in between. We have telehealth therapists as well, and in fact, every one of our therapists can do telehealth for an hour. So even our staff in Woodstock would be able to be a choice if they wanted, let's say, that person had the means to get there or wanted them via telehealth. So, yeah.
Okay. Any other questions from the board? Thank you so much, Lindsay. Good to see you again. And finally, our last presentation will be from Mathers Recovery.
Thank you. I'm Dr. Vemuri, V-E-M-U-R-I, Medical Director at Mathers. I want to take a minute to talk about what we did with our last year's funding. We were able to provide naloxone to multiple community centers, did a lot of teaching and distribution, also fentanyl test strips, and peer support services for Dundee Township patients who were engaged in medication-assisted treatment for substance abuse. Also developed part of a website to help find Dundee Township resources for our patients. Going forward, we'd like to increase what we're doing in the community, have more presence in local organizations, do more training for naloxone overdose prevention, and also awareness of other services that we provide. We want to increase peer support with peer recovery coaching, and also look at increasing some bilingual services. I think 15% of the population is Spanish speaking. That's it. That's under 2 minutes?
This is. Could you clarify 50% of the population of where?
East Dundee.
Oh, East Dundee. Okay.
Yeah.
Got it.
For Google said that.
Okay. Because we know Dundee, it's actually, we're just under 50%.
Oh, wow. Okay.
I'm sorry, under 40% population Hispanic. So when you said a number, definitely the number is East Dundee. Got it. Okay. Questions from the board?
Yeah. So,
Mr. Auger.
First comment. I'll say that I've been underimpressed with the website that you set up for Dundee Township. With all the things that you say you've done, I would have expected more content to be put there.
One of the things we definitely want to expand on is improving the website and the content on the website.
Okay. And this application, so you now want to provide mental health and substance abuse services? Is that what we're...
No, this is more community outreach, so we want to be more present at community events, providing overdose teaching, naloxone, providing naloxone to the community, more education about medication-assisted treatment.
And that's $75,000?
I think they'll...
Yeah, I think that's what we have asked for, yeah.
Okay, thank you for confirming that.
Any more questions for now?
Nope, that's it.
Any other questions from board members? Thank you very much, Doctor. We've now concluded the presentations of all of the agencies, so thank you very much for being in attendance. We're going to continue on with old business. Chair will entertain a motion to allocate funding for the police social worker program expansion in an amount not to exceed $120,000.
So moved.
Moved by Harney. Is there a second?
Second.
Second by Corrins. Discussion before we start. I want everybody to know that with what was discussed with the Village of Carpentersville was for a pilot, start with 1 year with possibly extending to 3 years. I understand what came up at a meeting 2 months ago. There were some saying this should be funded all the time. There's some who are saying this shouldn't be funded at all. We are operating in the middle. To how do we start this? And we're looking at some of our best of best programs from around us. You know, I look at McHenry County and the police social worker program. It started out where the pump was primed by the mental health board working with their sheriff's department. And I know our staff has attempted to do this with the Village of Carpentersville, we don't have a countywide mental health board, and our sheriff's department is averse of doing anything different. We're going to have a new sheriff elected next year. That's likely to change in the long term. But for now, in the here and now, we have heard from all of our first responders that we need to have a police social worker program. There are stats from other villages and townships, and clearly from the county, where there are measurable success of a police social worker program to provide the crisis intervention that's so needed. So I want us to keep to the scope of what we're doing here. And then also, this is just a first stage. The biggest stage and the media stage is going to be the intergovernmental agreement between the Dundee Township Mental Health Board and the Village of Carpentersville. That is going to be the one where it's literally in writing what this is going to entail, and it's going to be along the model that was negotiated back when Mr. Sanchez was our administrative coordinator of, this is a pilot. This is not to be funded in perpetuity. Yes, a future mental health board can decide to make changes or to discontinue it. That's up to them. But in the here and now, this is to prime the pump and begin this that we have heard from day one of our community mental health roundtables from our first responders. So with that, I'm going to open up to first staff. I want to know if there's any additional information that we need. We all have the responses to the questions that was in your packet. I'm sure you reviewed them. So if there are any questions to staff that you need answered, please refer them to staff, and let's go from there. I'm going to take this. I'm going to do, to keep this orderly, I'm going to keep this to the seniority. I'm going to start with Member Auger.
Okay. So there's a couple things. I was made aware today that there was a conversation with the West Dundee Police Chief.
Correct. I was going to talk about that.
And what I want to understand, what I thought I understood from the conversation was the police chief has no interest in pursuing funding for this going forward.
Sure. Okay, let's
so with that, I guess my concern is, if we're going to go forward with this, I would like to see a commitment by the elected officials that they are going to pursue funding for this, so that after we do the first year, and I hesitate to call the first year a pilot because Carpentersville's been running a police social worker program for a period of time. So it's not a pilot. Everybody knows how it works, and they've got metrics that they can share with the public and the other communities to do that. So I guess one of my hesitations is that if we're not going to get other communities to engage in paying for this going forward, let's not set this up for failure. Let's put the brakes on it until we can get that support. The second problem that I have is it seems like we are going to have a long-term problem being able to cover all of Dundee Township. It sounded like there are certain areas which they're not going to be able to cover. And I'll speak as an Algonquin resident. I'm paying taxes into a program, and I'm not going to get to use it. Fortunately, right now, my village pays, for Kane County residents to get that service. But as a taxpayer in Algonquin, I don't think that's fair that I would be double billed effectively. So those are the two concerns that I have. The primary one being we need to make sure the other communities are committed to funding this.
Okay. I want to make sure we're very clear that the other communities in the initial, pilot may not be a good word, but the initial phase, or whatever you want to call it, in addition to Carpentersville, and that's the only community that we as a mental health board will have an intergovernmental agreement with. But the other communities are East Dundee, West Dundee, and Sleepy Hollow.
Where do we get these agreements from? Who said this?
Okay, that was presented at our June meeting or July meeting,
right,
where they showed the model where Carpentersville will be the middle
right,
people.
But who said this? This is going to be what you just said. You know, the Bridgestone, that's gonna be.
That was shared at the presentation, and that was going to be the direction that Carpentersville knew to set up these intergovernmental agreements with
They're
East
not
and West
going
Dundee.
to. Because after what I heard today, there is no bridge.
Okay, did you meet with Sleepy Hollow, and did you meet
No,
with
I
Carpentersville?
talked to one of the trustees' wives. She said they don't have the money for it, for Sleepy Hollow.
I get a chance to talk here too, and I can answer a lot of these questions.
Yeah, let's just start with
But we're
Sue.
going from.
Hold on.
There are nuances here that are inaccurate. Let me
What's
put
the
it that way.
inaccurate?
Okay, let's keep this orderly. Let's let Ms. Harney give us that, and then you can respond.
Okay.
Go ahead.
Joe and I met with Chief Sean Green today in West Dundee. He's been there about a year. He came from Schaumburg. He is a strong supporter of this program. He said it made a huge difference in Schaumburg. It was a measurable difference, a double-digit drop in crisis calls within like 6 months. So it made an enormous difference, which saves a lot of money. It saves a lot of money across the township for everybody. That is part of the buy-in for this. And yes, he also said that he doesn't see where that budget money is going to come from. You know, Joe's worked there, and maybe West Dundee can scrape up, you know, 10,000 here out of Public Works and 10,000 there and everything like that. But he also said that he did not feel that West Dundee really needed a full-time social worker. He was not, he felt that it would be better to have, you know, a group of social workers, if you will, for the entire township. That he did not think a program where West Dundee has a social worker and Carpentersville has two and East Dundee has one, that was not as good a program, and it wouldn't be as effective as having, you know, a group of social workers like they do in Bloomingdale Township. And that would be more efficient and it would work better. He said one of the big problems is how this is going to be coordinated. And Ray, I agree with you. I think this pilot program, which I support, you know, we can get started there. But there's some structure here that we need to talk about and figure out. And Belinda, you brought this up last time. You know, who is going to be the project manager? And Chief Green brought this up today. How is this exactly going to work? What are we going to do if there are a social worker and a half or two social workers headquartered in Carpentersville, and 3 calls come in, one from Sleepy Hollow, one from East Dundee, one from West Dundee, and they're all critical, and there's not enough social workers. How is that going to be handled? Those are the questions that we need to find out. One of the things that he said was that he felt, and I agree with him, we need to start with a much bigger program. I would like to start with at least 3 social workers. I think that would be somewhat, and that's just a spitball figure or a spitball number on my part. I'm not going to die on that hill. Maybe it's 4, maybe it's 2. I don't know, you know, for what we need here. But it seems to me, based on what he has learned from Schaumburg, that 3 might be a good way to start. I would like to see them based or operated through Quadcom, because Quadcom serves the entire township. It serves a little more than the township, but I think those things can be worked out. And I think all residents should have access to it. I don't know, originally, and there was a gap in my being on this board, originally when this was brought up, my understanding was that the Village of Carpentersville was very adamant that it operate out of their police department and that their social worker be the person in charge. I'm not necessarily opposed to that, but one of the things that got held up for so long and has caused such a drag on it is they didn't have the space. And so maybe, you know, we're talking, was it Family Services? They want to open an office here. Maybe we need an office over in Carpentersville, you know, adjacent with that, or in another place where these social workers can work. You know, phones are easy, they're fast. What the Schaumburg model does, and I don't know if Bloomingdale Township does this, but the social workers in Schaumburg, they literally have the police, they have call signs, they have those police phones, and so, you know, a call comes in, there's a problem over at this place, and during the back and forth with 911, it becomes apparent that a social worker might be the ticket and everything. The social worker gets called in. And again, it's like calling a police car from out, you know, doing a patrol and everything. The social worker's on duty, he gets the call, and drives to meet them. and everything like this. I think that's a much better model, and those issues, I believe, can be addressed with the contract, or the memorandum of understanding or agreement that would start with Carpentersville. Will we get all of that done at once? Probably not. I'll keep working on it, but that's my vision. Do we need to start? Absolutely.
Okay.
We have, let me
Okay, I thought you were done.
I've said this before, but I'm going to harp on this every single time. The voters have directed, not asked, not suggested, they have directed this board to provide mental health services for this township. They have allocated a little over $3 million that this board has access to every single year. Do we have to spend the whole thing?
What was the voters' turnout?
No,
All right, let's
no,
fin-
you know,
let's-
I
no.
thought I was second after Ray.
You will be. She has to finish, sir.
Okay.
Let's let her
Why
finish.
would she go? That's,
Let's let her finish.
Okay.
Let her finish.
I was supposed to go next.
That's
You are.
good.
No, I was supposed to go after Ray.
The voters have told us to do this. And every single village, and I've been a village ed trustee in Sleepy Hollow for a number of years, my husband was before. The village of Sleepy Hollow does not have 3 nickels to rub together. I could tell you why, but it's not important. They don't have it. But they do have not a huge need, but a need. And their voters came out and they said, we will pay more property taxes so this service can be provided. Now, did they do it alone? Of course not. They did it with everybody. That mental health statute, or the referendum that passed, people worked on that for decades in this area. This was not something, and I know, Joe, that you have said you have people that didn't know about this. I'm
They
sorry.
don't.
I watched this for year after year after year. And
I've been
here
canvassing
since
the
1978.
neighborhoods,
Okay.
and no one knows about it.
Okay, I want to move it over to Joe. Thank
Okay.
you for your update. Joe, you're at this meeting, I
I
understand?
was at the meeting.
Okay.
She's right about all the stuff that she said. You know, the big pie, you know, but there is no bridge. We're going to be caught with this $120,000 every year, plus she wants to add on 3 more counselors to help out. That's going to be additional $120 on top of that, each one of those. We have to pay for their salaries, their retirement, their 401k. It's just going to keep on snowballing. There's no end to it. This is just another layer of government. I'm sorry. I know my voters are going to be a no.
Okay.
You know, seriously, because Sleepy Hollow is not going to flip it. I talked to the chief. He's not going to budget for it. All right, and he has the opportunity to budget this starting next year. It's still a no. He doesn't want to touch it.
Okay. Thank you. Other members of the board?
Oh, hold on. There's
I
another
thought you were
thing.
done. Thought you were done. Okay.
Plus, this also doesn't even touch everybody in the township, like Ray said. The unincorporated township doesn't even get anything out of this. That's another problem.
That doesn't have to be that way.
Okay. Let's go one at a time.
You know,
Joe,
but where do we
finish.
stop raising the taxes that she wants to keep on doing? You know, we need to cut the funding. The rents are going to go up. Okay, doesn't mean just for rents, for houses and apartments. That means for your storefronts, for your businesses. Those are going to keep on going up. So it needs to stop.
Okay. Are you completed?
That's fine. Go ahead.
Thank you. Other board members?
I can address some of these if you would allow me to.
Okay, let's let the other board
Wait, hold
members.
on. So back to what we were saying also.
Okay.
There is no truth to this. There's a bridge. There's none. Okay? So what you told me and what he said today up here on the podium, there is none of that. That is not true.
We don't want to get.
We're gonna get flipped for this bill. When it's hooked, it's our bill forever. It's not gonna go away.
Okay.
And there's gonna be a $3 million levy coming, and I guarantee it. And then your taxes are gonna go up, and yours are gonna go up, and yours, and yours, and yours, and everybody in this room is gonna have high taxes on their properties, and we're all gonna sell.
Okay. All right. Appreciate the input. I want to let
She
other.
even said it today.
Okay,
She
Joe,
wouldn't mind raising up to $3 million.
Okay, Joe, we're not. Let's not
You
get.
sure did.
Let's not go into the back and forth. Let's just stick to the issue at hand. Member Adame, do you have anything to add to this?
Just want to clarify, we're addressing the questions. right?
Yes, I want to make sure we're addressing the question. This is what we have the motion for: police social worker program expansion in an amount not to exceed $120,000.
Yeah, they answered my questions, but it doesn't seem like they're open to the recommendations that I made about licensure and ensuring supervision. So that's something that the one clinician who gets hired is going to have to outsource, and something that can possibly cost money. And also about the justification for the salary. So yeah, they did answer it, but they're looking back to us for responsibility for, what does it say, more feedback, and if we're interested in doing further research, then they'd be open to receiving whatever research we do on that topic.
Okay. Anything else to add?
No.
Member Corns?
No comment.
Okay. Member Hogg, did you have any last? I don't know if we finished with your inputs.
I just want clarification. Are we voting to allot them the money tonight, or are we voting to are we voting to give them the money tonight, or are we giving them a preliminary okay to go take a look at some of the paperwork or NGAs or
motion
IGAs?
to allocate. So just like we do with the agencies, we do the allocations first. Then there are contracts, and this contract will be an intergovernmental agreement.
Okay.
So this is the first step along our normal parameters as we work with funding agencies. We're voting to allocate tonight.
Okay, so I want to be absolutely clear. We're not funding them tonight.
Correct, because we have to have an IGA, and of course it has to be approved by their village board, their being Carpentersville Village Board, as well as our mental health board.
Okay.
So this is the first step, and right, if the IGA falls through, it's just like with a contract with an agency. If it falls through, we don't fund them.
Okay, so we have the opportunity while that IGA is being written to put our requirements into it?
Definitely yes.
Okay, because
of course, will they agree with it? That's a different matter.
Yeah,
but
because I will not agree to allocating the money if we are not going to ensure that all of the communities are going to pony up money to help support this, and if there isn't a plan to go ahead and make sure all of the residents of Dundee Township who are paying for it are going to get it.
Okay. I understand. Hold on, let me finish. I understand what you're saying there. This is just a first step, and I don't want it to be an exceedingly long process, but once we approve this allocation, that's when our council will begin developing the contract. And of course, remember, they developed the pilot that kicked off the McHenry County mental health police social worker program as well. So our council has experience with this. And obviously they also negotiate what the various municipalities that they serve and prepared their IGAs. Because I remember I read, Algonquin did approve theirs earlier this year to go beyond the first 2 years.
Mm-hmm.
I think they approved it 4 years, if I remember.
Yep.
So yeah, this is a first step in a longer process. So, Member Connolly had your hand up.
Ray, she already made it clear Sleepy Hollow is not going to cover it. All right, and we already discussed the same thing what she just said. West Dundee's not going to cover it at any time. So what's the point? Seriously, what is the point of waiting to okaying it today so you can negotiate? It's going to be a no.
You don't know that for certain.
She just said it.
I said
and the chief already said it.
No, what she's referred to is that Sleepy Hollow doesn't have 2 or 3 nickels to rub together for whatever
right
reason.
There, and West Dundee already said it today.
That doesn't mean it's always going to be that.
That's right.
The budget said the chief said he will not put it in his budget. He does not want to touch it.
The budget for a municipality is
sure did.
Okay. The budget for a municipality is generally May 1st, so their budget process for their fiscal year 27 will start in about 6 months. Okay. So that's that. Okay, Mr. Auger.
Anybody else?
I just wanted to say that the village boards are the ones that come up with this.
Yes.
And that's a negotiating thing that goes on. And this is a pilot project. And so, as I'm sure you all realize at this point, I am totally in favor of the mental health board picking this up for the long term. But that's just me. And so I understand that others differ, and that's okay. But I have been here a long time, since 1978. And I have watched many really fine programs that the village has participated in and put together for a while, and then they fall off. So, but this can start, and it may be that this is the time that the benefits become so great that they will cough up the money afterwards. We'll see. But I think getting it started if nothing else,
Where do you think the money's gonna come from?
All right.
Chris, Mark, let me talk because you shut me off last time.
All right.
Where's this money coming
okay,
from?
No, this is not a Q&A like that.
it comes
I will
from property
recognize.
taxes.
Okay, so property taxes.
Yeah.
So that means our taxes are gonna go up. Is that okay for everybody?
The
It's
majority-
not okay with me
well,
and my
the
tenants.
majority of voters in this township said it was.
Okay, what was the percentage of voters at that time? How many people voted at that time? What is the percent?
It was in 2020, I don't know.
Well, let's
But
find that out,
It
because I
doesn't-
guarantee
it-
it's under
It's any
7%.
difference. It's a
It
majority.
was a small turnout.
It doesn't matter.
It does matter.
No,
And it
well,
was not a small
Because
turnout.
I talk to the
It
people on the
was a
streets, they don't even know it
25%
exists.
turnout.
Okay.
That is one of the highest turnouts.
was not a
in-
turnout.
Yes, it was.
okay, all right. Also, we all know the tale of what happened before we could even do a first levy, so the question was vague to some people, but that's been solved through legislation. Again, another long, protracted process, which is what we're going to begin here if we approve the allocation. Mr. Auger, you had your hand up.
I was just going to state, I can support the first step, but I will not approve it unless there is a plan as part of the IGA that covers how the entire township's going to be covered, and a commitment from each of the municipalities that involve that they're going to find funding for this.
Okay, thank you. I think everybody's had their say. I will have my say now, and then we will call the roll, so be ready. I'm in agreement with Member Auger. I will definitely support the allocation, as stated here, and then we need to get our council working on this. And work with, it starts with Carpentersville. That was the model that was presented to us 2 months ago. Carpentersville, our attorney, their attorney will hammer out the agreement. Our board will have input. Every member of this board will have input. And then we will see, and obviously every member of their village board is going to have input from their point of view. Because remember, IGA is 2 people have to sign the contract. So I will say I am going to support this, knowing that I could easily not support an IGA unless it meets the bulk of our needs. This is just like a collective bargaining. You're not going to get everything, you should get most things. And if you don't get everything today, after the pilot, like we saw with Algonquin and the McHenry County agreement, they got it later. So with that, Secretary, please call the roll.
Adame?
No.
Auger?
Yes.
Connell?
No.
Correns? Yes. Harney?
Yes.
Avalar?
Yes. Thank you. We're going to move to the status of the 2025 Dundee Township Mental Health Survey. Ms. Began.
So,
Oh, I'm sorry, Mr. Auger.
yeah.
Sorry.
So the survey is completed. 500 residents completed the survey. Metopio has provided the summary report. I have sent a link to that, or I've sent that document to everybody. It was 37 pages long, so I did not ask Coordinator Kate to print that off for everybody, but I would ask everybody to review it and provide any questions you have, so that we can, if there are any questions, we can pose them to Metopio to answer for us. And ideally, we need to approve this, so I would hope that it could be approved at the November meeting.
Okay. Any questions for Mr. Auger? All right, we're going to move to new business. We have several grant allocations to approve. These are the straight out cut and dry ones. These are not new programs. These are existing programs that we've been asked to fund. So that's why there are only 5 of them to be done. So the chair will entertain a motion to approve the grant award for Easter Seals of DuPage and Fox Valley Pediatric Outpatient Medical Rehabilitation Program. Moved by Adame.
Second.
Second by Correns. Any discussion? If not, please call the roll.
Adame?
Yes.
Auger?
Yes.
Connell?
Yes.
Correns? Yes. Harney?
Yes.
Avalar?
Yes. Chair will entertain a motion to approve the grant award for Ecker Center for Behavioral Health Outpatient Behavioral Health Program. Moved by Adame.
Second.
Second by Corrins. Discussion. Secretary, please call the roll.
Adame.
Yes.
Auger.
Yes.
Connell.
Yes.
Corrins, yes. Harney.
Yes.
Avalar.
Yes. Chair will entertain a motion to approve grant award for Ecker Center for Behavioral Health Crisis Service Program.
So moved.
Moved by Harney.
Second.
Second by Adame. Discussion. Secretary, please call the roll.
Adame.
Yes.
Auger.
Yes.
Connell.
Yes.
Corrins, yes. Harney.
Yes.
Avalar.
Yes. Chair will entertain a motion to approve grant award for Northern Illinois Special Recreation Association Respite Funding Program. Moved by Adame.
Second.
Second by Harney. Discussion. Secretary, please call the roll.
Adame.
Yes.
Auger.
Yes.
Connell.
Yes.
Corrins, yes. Harney.
Yes.
Avalar.
Yes. Motion to approve grant award for Chair will entertain a motion to approve grant award for Pivotal Counseling Mind Matters Series Program.
I'll move.
Moved by Auger.
Second.
Seconded by Adame. Discussion. Secretary, please call the roll.
Adame.
Yes.
Auger.
Yes.
Connell.
Yes.
Corrins, yes. Harney.
Yes.
Avalar.
Yes. We'll now move to discussion of the fiscal year 2027 levy and budget recommendation. Actually, that's 2025 levy and 2027 fiscal year budget recommendation. Ms. Began. Mr. Sanchez. Fiscal year budget, initial look, did you have anything to present with us?
I don't have an updated projection for you. We'll have that for you soon. But essentially, what we're looking at right now, given the current demand and applications, we don't know how much will be funded, obviously, at this time. But there is a potential for a recommendation for a slight increase in this coming year's levy. Also looking at the potential for the police social worker program funding as well. So I couldn't give you a figure right now. There is fund balance, still somewhat significant fund balance, as you see in the finance report. But as we saw last year with the projections, even at the $500,000 level in the current funding amount that you all have, we would be running out of money in 2 years. So, as it stands right now, there is a business case, which we've always discussed. We would never ask for an increase in levy if there's not a business case for it. Right now there is, but I couldn't tell you an exact amount.
Okay. What's incumbent, Ms. Began, between now and the November meeting is that we've got to make a firm recommendation to the Township Board, as we're statutorily required to do in order for a levy to be considered. So this has got to be something that gets done and is ready for the November meeting. So, Mr. Auger, question?
Yeah, if you wouldn't mind, President Avalar, I put something together just for some reference. It probably needs some double checking, but it might give us a place to start in terms of what we're looking at for an upcoming budget.
Okay. Can we just give that to staff and let them prepare this for the next November meeting?
Yeah, in the essence of time we can. I guess the summary is I don't think we need to increase the budget. We will have, even if we fully fund all of the programs at the asked amount, we will still have $231,000 left in our budget. And if we even increase the contractual services for staff by another $20,000, that'll still leave us over $200,000. So I can give this to.
Please give that to let's give this to Katie to work this out. And as I've said, I respect and recognize. I've told you to offline many times. I understand you're going based in 2 years, but I need to know what's going to be needed in the next year. Because obviously, that's what we got to give the input for the township board to discuss.
Ultimately, you want the context of both.
Yeah, definitely.
Next year and the next two.
Correct. All right. If there are no other questions, we're going to move on to discussion of implementing the Community Mental Health Act's provision for advice to the Township Board for mental health board appointments. I'll be brief on this, but as many of you will remember, back in May, we approved a set of bylaws changes because of changes made to the Community Mental Health Act, and the reason for this was because of a lack of transparency for considering members to be appointed by the governing board to the mental health board. Last year, it was added as an amendment to the Community Mental Health Act that it would need to be, to give the Mental Health Board, we set up our rules. We set up those rules in the bylaws amendment that we approved back on May 8th. So now we're approaching the end of the year, and it is at a point where 2 seats are going to be up at the end of this year, and because of the storied history of how this change to the law came about, basically one of our state representatives with their experience on the McHenry County Board a few years back, and a chairman that didn't share information. This is what this was to do in order to allow all mental health boards to have advice. Now the decision of who's appointed, provided they have advice and consent, still stays with the township supervisor and the township board of trustees. But what we placed into our bylaws was to, in order to see all of the applications, letters of interest, resumes, whatever, however Supervisor Shaw is going to set up the intake in order for us to review as a mental health board. The suggested timeline is by our November meeting, we will have a first cut at the applications and in executive session review and come up with a short list. And we have, since there are 2 appointments to be made, if we have just 2 people, it's pretty much a no-brainer who we're going to advise to appoint. If it's more than 2 people, and likely it will be, then we have the flexibility to invite them into an executive session interview before we make a final recommendation to the township board in advance of their December 17th meeting, which is when these appointments will be made. So I just wanted to advise the bylaws change we made back in May. There's a reason for this, and there's a reason with why our state legislators felt this was needed, because of a lack of transparency. I don't believe we're going to have a lack of transparency with our current township board, and this is just a way to ensure that it is an open communication who the members of the community who are willing to serve in this mental health board to set the future for this mental health board and advise the township board on whom we think, based on qualifications, should be appointed. Any questions? Okay. Go ahead.
Add something to that. I think it's really incumbent on all of us here in the audience and every place else to encourage people to apply. I would really, really like to see more than just a handful of people apply. In the past, we haven't gotten a lot of applications. It grew a little each time. And I'd also like to encourage people to apply who have a background in mental health services of some sort. This has been a long learning curve for me, and I have a lot of community involvement. But, I frequently don't know the questions to ask, even though I've read everything and looked at everything, because I don't have a background in this field. And I think that's really, I especially see that with you, Heather, and with you, Belinda, that, everybody here cares deeply and we try hard. There's no question about that. And everybody brings skills to this board that I think are valuable. But we really, really need a few more people with a background in different parts of the mental health field so they know which questions to ask. And I think that's, if we could encourage those people in our community to apply for this, I think we'll have a good board.
Any other comments? Thank you, Member Harney. Moving on, I do not believe we need an executive session tonight, so we're going to skip numbers 14 and 15. Board members' discussion. Member Auger, anything to say?
I think I've said enough tonight.
Member Connell.
Oh, now it's my turn?
Yeah.
You sure?
I think so.
You want to go to her first?
Nah.
Okay. No.
Okay. Member Adame. Member Corrins.
None.
Member Harney.
I'd like us to invite Chief Green to come and talk and speak for himself. I think
That's fine.
I found his.
You want to add more fuel to the fire? That's fine. He actually said he doesn't want to fund it. So what happens then? We're going to pick up the tab.
Okay. I would suggest a better forum is the community mental health roundtables that are taking place quarterly. And Ms. Fegan, if you could ensure that as first responders are always a part of that, let's have that dialogue there, and if we
Well,
need to
we
make
have
them
administrators come in, they're the ones who write up their budgets.
maybe that
We
would
should
make that
have
the
them
topic.
in here.
Maybe we have that topic, but I think the Community Mental Health Roundtable is probably the more appropriate place. I respect where you're coming from with the
I
board.
would like to see why they cannot afford it
Okay.
themselves.
Okay, very good.
And I think that's important, Joe. The distinction is not that Chief Green said he doesn't want to fund it.
He says he doesn't have the funding to fund it.
That's a different thing.
All right, but he doesn't want to. He can't put it in his budget.
Right,
He can't. So that means we're going to pick up the tab.
Which is a way different thing than saying he doesn't want to.
He doesn't want to pick up the tab.
He
He can put it in there. He sure can. He can talk to Joe.
Okay,
Talk to Joe
okay,
Cavallaro.
we get the picture. We get the picture.
You know, he refuses to.
Whether he refuses to because he doesn't want it, or he
Maybe
refuses
it's
to
already
because
been
he can't.
discussed. Maybe it's already been discussed. They don't want to pick up the tab.
Okay, well, like I said, our IGA process is going to begin, and we're going to put what we want in this IGA as well. All right, finally, board president update. I only have one, and it's something that I'm going to go ahead and share because we discussed on new business number 13G. Our bylaws also state that members who are of the mental health board who are reapplying for appointment cannot participate in the advice process because of the clear conflict of interest. We put that in there specifically, but I am also going to announce tonight that completely devoid of any politics, I will not be pursuing a second 4-year term on the board. I have too many changes coming up in the next 4 years, and particularly in the next 6+ months, both personally and professionally. So my term ends at the end of this year. It has been an honor to be on this board. It's been an honor that you've elected me to lead this board 5 different times. But after the first of the year, President Pro Tempore Harney will assume the duties of the presidency, as our bylaws state. And I will get legal clarification to ensure is it in the capacity of an acting president or just president, because that could matter for contracts, and we don't want anything to go amok with our contracts with the transition. So I know the Mental Health Board will do great, especially the members coming back, who will ensure that the transition will be as smooth as it can be, and I think it will be. But changes are coming, and basically come the January meeting, you will have a different person with the gavel here at the center of the dais. So thank you for letting me share that. And I do encourage, I echo Member Harney, members of the community in Dundee Township, by all means apply. And I'm sure Supervisor Shaw will set up an intake process when she announces it. Take advantage of it, but make your presence known. One clarification before the final object. Member Auger, you had November 6th as the date for the next mental health board meeting.
Ooh. Yeah.
It's supposed to be November 13th. Is there a reason why you had November 6th?
I think I had it written so that we would get our recommendation to you or to the coordinator in time to get included in the meeting packet.
Okay, so by November 6th, the recommendation from your committee will be done.
Yes.
All right, so that's what I read on the foil said the meeting's on November 6th. So with that, the chair will entertain a motion to adjourn until Thursday, November 13th, 2025. Moved by Adame.
Second.
Second by Harney. All in favor, please signify by saying aye. Aye. All opposed, same sign. We're adjourned.
Thank you.